welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan. Here is what I bring to you all from the world of medicine. Further clot risk reduced by extending the anti-clotting treatment after a distal DVT. Now giving the anti-clotting drug rivaroxaban to patients for 12 weeks instead of the usual 6-week period after a blood clot, especially in the lower leg, it reduces the risk of further clots developing up to 2 years after treatment. This is in accordance to a trial that was published by the BMJ. Rivaroxaban, as we all know it, is an anticoagulant drug. It's given to people at a high risk of getting dangerous blood clots to help their blood clot thicken more slowly. Now, anticoagulation, as we all know it, is known to prevent any further clots developing in patients who already have a blood clot in their leg, including those with isolated distal deep vein thrombosis. But doctors are still not sure whether all patients with the distal DVT should receive anticoagulation and for how long. Potential biomarker predicts resistance to immunotherapies in melanoma. The Duke Cancer Institute researchers have identified potential biomarkers that actually predict the likelihood for checkpoint inhibitor drugs to backfire, driving hyperprogression of melanoma cells instead of unleashing the immune system to actually fight them. The new study that I'm talking about is conducted in mice, and human tissue points to a strategy for inhibiting the hyperprogression, potentially benefiting an estimated 10% of cancer patients who actually undergo this devastating complication from the checkpoint inhibitor immunotherapies. Sleep disorder drugs linked to higher risk of overdose in teens and young adults. Teens and young adults who are treated for sleep disorders, specifically with benzodiazepines such as Xanax, which is a medication commonly prescribed to treat anxiety and insomnia, may be at a higher risk of overdose, according to Rutgers researchers. The Rutgers researchers said the risk of drug overdose in youth populations prescribed a benzodiazepine treatment for their insomnia is still unclear. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.